Welcome back to the agenda with your Missoula County Commissioners. I'm Juanita Vero, and I'm here with my fellow Commissioner Josh Slotnick. Commissioner Strohmeyer is out this week. We're here today to welcome Gina Miller, Chief Health Officer at Missoula Public Health, and she's joined by Sarah Heineman, Director of Health Services at Missoula Public Health. And they're here today to talk about vaccine availability and other public health services. Welcome.
Thank you.
Thanks. Happy to be here.
Yeah, thanks a lot, guys, for coming. I want to
Is everyone feeling healthy?
throw a curveball at him right away, okay? Easy, though. Super easy one. So we're going to talk about vaccinations. But before we dive in, I just wanted to find out from you guys, how did you find yourselves in the world of public health? I mean, I can't imagine when you were 14 years old, you're like, I really want to be a public health person. That's my goal. And look at you, both of you now have lots of authority, and you really play very effectual roles in the general health of people in our county. How did you find yourself in these positions?
Oh, yeah. I love
this is
talking
Gina
about
speaking.
that. Yeah, I'm sorry. This is Gina Miller. I think that I landed in public health at random somewhat. And then fell in love with it. I got my undergraduate degree in environmental health and water quality technology, and then I kind of went rogue and applied for jobs all over the place, including Missoula, and moved from Havre to Missoula and landed at the health department when I was very young. And then went to the University of Montana for my master's degree and found out that the broad field of public health is pretty much everything I care about, all wrapped into one field. I mean,
That's beautiful.
It's things that I have valued and have been really passionate about just in general and socially and scientifically for a long time. And so I'll stay forever. It will always be what
Gina,
I do.
We are very thankful.
Oh, yes, absolutely.
So you will outlast me. I'm thankful anyway. Sarah.
Gosh, yes. I did a senior clinical rotation from nursing school at the public health department and was to implement HIPAA way back when. That's a whole nother topic. And then when I was working at the hospital as a nurse, there was an opening in the immunization clinic at the health department. So I did that as a public health nurse and then tried out home visiting. And then I became a nurse practitioner and worked in the world of urgent care and primary care. And I really missed the idea of preventative care, and wanted to make more of that upstream difference in my community by being able to focus on preventative work, because our medical society really doesn't have that focus. No.
So for both of you, would it be fair to say this is a bit of a calling?
I would say yes.
I would say yes. I love my job. I think it's a dream job.
I agree.
We get to show up every day and just try to make the place better. That's pretty cool.
Man, we got to ask this question of all our guests. I'm embarrassed that we haven't done that. Thank you both so much for that.
So there's been a lot of talk out there in the federal world and the national world about vaccines and the availability of vaccines and what insurance won't cover and will cover and what's needed and what isn't. Can we talk about COVID, because we're heading into winter? What is available? Who can get a COVID vaccine, and why do you think there is so much confusion?
I will start with just the short statement that to explain what's going on with the COVID vaccine this year, we really have to dive into how vaccines are reviewed and tested and approved in the United States in the first place. And Sarah is excellent at telling that story.
Sarah, tell us that story.
Well, I will try. Well, there was a lot of confusion this year about the COVID vaccine because it didn't follow the normal processes. So I'll just start by saying that anyone 6 months and older can get their COVID vaccine. It is with shared clinical decision making, which I'll explain a little later, but basically means you just have to have a conversation with a medical provider.
And what are the normal processes when you do your
explanation?
explanation?
So there's a lot that goes into making vaccine recommendations. If you're thinking about vaccine development and you go back even further to that, you go through the FDA and all of the different pre-clinical trial, clinical trial steps of safety and effectiveness, and it can take years to go through those processes to a licensed product. And then the FDA has their prescribing information that describes what the product and how it should be used, who it's for. And then the Advisory Committee on Immunization Practices, which is a committee through the Centers for Disease Control, CDC, would get together 3 times a year, and they would review all of the data, the safety data, the efficacy data, and then they would make recommendations about those vaccines. And so where we went awry this year was earlier this spring when the ACIP committee was all
What committee is that?
The Advisory Committee for Immunization Practices. So that committee was terminated by the current Health and Human Services Director, Robert Kennedy Jr., and he reappointed some of his own people who have some differing ideas on vaccines. That committee didn't meet on their scheduled timeline in the spring because of those changes that happened. And so the FDA interestingly went ahead and met and made their own recommendations internally for this year's seasonal flu vaccine, which also created some confusion. Usually we're part of the World Health Organization, they're all these different countries and groups come together and they look at what's going on in the Southern Hemisphere for the next year, and they collaboratively come up with what the influenza strains should be included for this year's seasonal flu vaccine. And that didn't happen this year either. So that, yes, so that also started out with creating some confusion. With COVID, the FDA then went ahead and they made their own recommendations for the COVID vaccine, and they changed that. And they said that anyone 65 years old and older or someone who has a compromised health system should get the COVID vaccine. And that's different than how we've been treating the COVID vaccine over the last few years. And that's because the ACIP committee didn't meet and there wasn't that robust review of the data to have those recommendations be made. And then as they added a few more members to that, they did have a meeting in late September, which it's already the respiratory season, right? Clinics are gearing up to give their flu and COVID vaccines for the fall in usually September and October. And so the ACIP committee met at the end of September. They had a tie vote of their committee that said anyone 6 months and older could get the vaccine, and then the committee chair broke the tie with shared clinical decision making. So meaning that you're a medical provider, a registered nurse, a pharmacist, you have that conversation, you discuss the risks and benefits of the vaccine versus the disease, and then you can get that vaccine. Well, once the ACIP makes that decision, the CDC director has to adopt that or endorse it. And that was also delayed. So it took another couple of weeks for the interim CDC director to endorse and approve that recommendation. So in the meantime, you had these other nationally recognized organizations like the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and then the American College of Family Physicians come out and make their own recommendations.
Wow.
And they were all in alignment. And so,
all of those organizations were in alignment.
Absolutely, yes. And you saw a lot of other states standing up and either setting up statewide collaborations. So there was the Pacific Northwest statewide collaboration, there's a Northeast one, there's some other states, and they were coming up with their own recommendations for those states together to say, we're going to follow this information so that people could start to get the vaccine out.
With all those different organizations, at least you said the medical ones were in alignment, but how about those ones that were designed around geography? Did we have alignment there too, or did we see differences?
The ones that joined together definitely are aligned, yes. So there are
So it's
ones,
not like there were 15 different opinions out there. It sounds kind of
I
like
would
there
say
were
they were
two
pretty,
different
they were
opinions.
pretty aligned with what the ACOG, AAP, and the American Family Physicians said.
So what's that mean for where we are now, or what does it mean then for,
Well,
can Josh go in and
absolutely
get a COVID
Yes. So once
shot, if you will?
And are you thinking I'm over 65?
Oh, I was
Just
like,
don't
oh, so
say-
sorry,
just
so
don't-
sorry.
Just don't.
anybody 6 months and older can get their COVID vaccine now.
And how
You're
much
over
does it
6
cost?
months.
Actually got me there.
Insurance is supposed to pay for it.
Okay, and if you don't have insurance,
Well, if you come to the health department, you'd probably qualify for a no-cost vaccine with a sliding fee scale for the administration fee.
So let's just drill down on that a little bit, because that sounds like some really important public information.
Yes.
A person can go to the health department and get a vaccination, even
Absolutely.
if they don't have insurance.
Correct.
Do they have to set up an appointment?
You can, if that works for you.
How would a person go about doing that?
You call 406-258-3363.
Is there an online version, or do you just do it by
You
phone?
just do it by phone.
Awesome.
and
Great.
then you said sliding fee scale, but like, what are the numbers? Because we've heard some crazy numbers on
That's a
what
good
certain
question.
drugs are called or costing.
Yeah.
I mean, it's
I mean,
kind of insane. So
Yeah.
what are the
are
numbers?
we talking like $10 to $50, or is it 10 to 1,000?
As a local health department, as a vaccine for children provider, we also have vaccine for adults. So that is federally subsidized vaccine that comes through the state health department to local health departments. So we don't have to pay for that vaccine. We can charge a minimal admin fee to like poke you with
fantastic.
the vaccine, right? And that's the piece that we can slide. And so depending on somebody's income, we don't ask for proof or anything like that. You just fill out the little form and then it will slide down to zero depending on that information. So it's really easy to do that. And then we do appointments on Wednesdays, and then Monday, Tuesday, Thursday, Friday, it's walk-in. So
Awesome.
at
Great.
your own convenience.
So you don't even have to make an appointment if you
Correct.
want.
Yes.
That's great.
It's not just flu and COVID.
Yeah.
We've been talking to a lot of people about vaccines these last couple months, and that's something that I think surprised some folks, is that we have all routine vaccines available at the health department.
Oh, that's great.
Are you current with your shingle shots?
I do need to get a shingle shot.
It's
I don't need
just
to
a
get
couple
shingles.
blocks
I just
away.
need to get the shot.
Yeah.
Yeah. Rather not get the shingles.
Come
just
on
the
down
shot.
and see us. Yeah.
So are the same rules apply? Like I know at the pharmacy and Albertsons, they do.
Yeah,
vaccines.
pharmacies are a little bit different. So each state has their own state laws about how pharmacies can practice with immunizations. And so all of this goes back to that ACIP committee vote, right? And so the Advisory Committee on Immunization Practices and the CDC endorsement of that is tied to the Affordable Care Act and whether the
Wow.
insurances will cover that as a preventative service. So that's where all of the insurance payers were starting to step forward and say, we'll cover COVID vaccine for this season. Because that was being so delayed in the recommendations coming out. The other thing that is tied to that committee that's super important are the Vaccine for Children program and then folks that are on Medicaid. So if the advisory committee didn't vote for that, for example, then that would not be available through the Vaccine for Children program and Medicaid wouldn't cover it. That vote was critical and that endorsement by the CDC director was critical to make sure that that vaccine flows through the normal channels. So with that, insurance payers are covering it because that's what they're supposed to do through the Affordable Care Act for as long as that continues to cover preventative services. And so then with pharmacies, they were on hold with all of this because the PrEP Act, which was a leftover emergency act during the pandemic, which allowed all pharmacists to vaccinate down to age 3 for flu and COVID vaccines, regardless of state laws, was also put on hold because of this, because that was tied specific to those ACIP recommendations. So once that CDC endorsement was opened up, then that National PrEP Act allowed pharmacists to go back and do that. In Montana, we have Montana Code Annotated and some rules that talk about how pharmacists can vaccinate. And they have to be an immunized certified pharmacist, so not all pharmacists offer vaccines.
Who does that certification?
It's through the state, I believe.
Okay.
Yep. And then they kind of have two forks that they can take. One, they can set up without a collaborative practice agreement. Collaborative practice agreement is something that's with another prescriber. So it's kind of like a standing order or an agreement that says you are collaborating with me as a prescribing provider that you can give these vaccines. So without one of those, pharmacists can give flu shots in general to ages 12 and up, pneumonia, Tdap, which is tetanus, diphtheria, and pertussis, to those that are 18 and older, and then shingles. So they have a limited scope of practice in normal times without a collaborative practice agreement. With a collaborative practice agreement, they can give vaccines identified within that agreement down to age 7. So it gives them a broader scope of practice. And then the PrEP Act right now kind of it allows them to go down to age 3 for flu and COVID vaccines.
Right. So earlier you mentioned the seasonal flu and it sounded like some of the recommendations on what that vaccine should be for each winter weren't done in the typical pattern.
Correct.
So does that make you feel differently about this year's seasonal flu vaccine?
No, I think it's still very important to get vaccinated. Vaccine is one of the factors that's going to help prevent you from getting influenza. So influenza is not the stomach flu. It's not a 24-hour, vomiting, diarrhea kind of flu. We use those words interchangeably, and this is a respiratory disease. And so people get very, very ill where they have fever, headache, sore throat, cough, congestion, body aches, chills, and they're usually out for a week to 10 days with this respiratory illness. It's quite contagious. And so we get the flu shot to help prevent that. And then ideally, you would wash your hands, stay home when you're sick, avoiding other people when they're sick. And that will help you get through this respiratory season.
Great. If I understand it right, you all went through kind of a countywide vaccination assessment.
We
Can you
did.
describe what that is?
Yeah, this is very cool. We did a vaccine access and barrier
Is this
assessment.
routine? Do we always do?
No.
Oh.
No, we had some funding from our COVID days that we were able to put towards this. And so we hired a third-party research group this spring, feels so long ago, but it really was just
This
spring.
does, yeah.
It was in March and April. So we contracted with Claris Research, and they had ties to the University of Montana. And we asked them to help us conduct a community-wide vaccine assessment that would look at Missoula County.
Can I just add a thing
Absolutely.
while you're
Yeah.
kind of gearing up to talk about the details? I think that one of the things that we contend with here in Montana is the fact that this data is not readily available, that it's really hard to get. So it's not routine for us to do this assessment. And unfortunately, it's not data that we can easily access without investing a whole lot of funds. And these were, one-time funds well invested so that we could collect community or county specific data and adjust practices. And we had a big ask of this this research group, and they were phenomenal. We had a short turnaround because the funds had a expiration date, and so it was a bit of a scramble, and boy, they certainly they delivered. It was amazing.
Describe what the ask was. What did you ask them to go look at?
So what we ended up doing was a point-in-time survey looking at something that they could fill out online, or they could ask for a paper copy to be mailed out. And of the people who did that, they could volunteer if they wanted to participate in an interview. And so this is considered a non-experimental, cross-sectional type of a research project. And our research coordinators stratified random sampling, waited for an oversampling in the rural areas, meaning we're trying to get more of our rural community members to respond so that they have representation. And they used publicly accessible property data from the Missoula City County Property Information System. So we sent out a little postcard to over 3,000 households, both single family and multifamily units, that represent all 80 census blocks throughout Missoula County, and they were randomly selected. And then we sent a reminder postcard, and then we ended up doing some more work in our rural communities where we hung up flyers and put just additional stacks of postcards at the grocery store, the post office, and trying to get more people to respond. So of that, they had 388 surveys came back.
So 10%?
Yep, which was great.
That's really great.
They were very happy with that number. Of that, then they looked at I think there was 204 people volunteered to be part of the qualitative interview, and so they selected 10.
That's a high number
Yeah.
for that, too.
So they interviewed 10 people kind of across the board with however they answered the survey questions so that they had a diverse response from those folks, and they got some very rich information. The questions that we asked, there's three different questions with some sub-questions, and the first one was, are Missoula County residents getting vaccinated? If so, where? Are they coming to Missoula Public Health, or where else are they going? And then the second question is, what are the barriers to getting vaccinated at Missoula Public Health or any place else? And then what could we do to help build awareness or improve access to vaccines in the public? And then the third question was, what are Missoula County residents' concerns related to vaccines? And then what could we as Missoula Public Health do to address those concerns? With the first question, are people getting vaccinated? Yes, over 90% of the people that responded said they had received a vaccine in the last 2 years. Most adults use the pharmacy or their healthcare provider, and for kids, it was their healthcare provider.
Does it say what kind of vaccine or just their
It's just
vaccine?
Any vaccine.
Okay.
We just wanted to know if people had received a vaccine. That was the hardest part, was drilling down the questions and trying to limit it with not asking so many questions. I had so many questions.
Yeah.
Yeah, I'm sure.
I didn't have the time or the money to ask them all. So with the second question, what are the barriers to getting vaccinated at Missoula Public Health or elsewhere, and what could we do to improve that? It's interesting because 59% reported ever receiving a vaccine from Missoula Public Health. And my guess is that a lot of that was during COVID. So they probably came to like Lucky's or one of those places during COVID. But only 11% of those people had come to us in the last 2 years for a vaccine. So that aligned with what we had been feeling and seeing anecdotally in our own clinic numbers, just the decrease in numbers seeking services. So interestingly, more than 40% of the people who had not come to Missoula Public Health said because they didn't know we offered vaccine services. So that's definitely something that we're working on as an outcome. For those that did seek services at Missoula Public Health, one of the most common reasons was their trust in Missoula Public Health.
Way to go.
All right.
Yeah.
Nice job.
Yeah. And so I think that that second question and the results that we got have really driven a lot of what we've done after the survey.
Is there anything that surprised you guys?
I'm constantly surprised. I mean, look at my face. I'm always surprised. But one of the things that we learned in the survey that surprised me was that people didn't know that we offered vaccines. The other thing we heard in some of our discussions and outreach afterward is that folks believed perhaps that getting a vaccination at the health department would somehow take away a vaccine opportunity for someone else, as if we had like a limited stock. Not true at all. Health department vaccination clinic is for everyone all the time. And then the other thing that just sticks with me is that of the people who did not get vaccinated at the health department, the majority of them said if they would have known that getting vaccinated at the health department supports the health department, they would have made that decision. So it's easy. You're at the grocery store and they have a pharmacy and you stop in and get your flu and COVID or whatever it might be.
And then they give you a coupon to go shopping.
It's true. It's true. And I think that what we offer at the health department is such a critical and amazing community service. We are staffed with trained nurses who will discuss all kinds of things with you, including other health department services that could really improve your life.
Wow.
Yep.
And just like any other public service, it's like adopting an animal from Missoula Animal Control supports the health department. Getting your immunizations at our clinic supports the health department. There's just a real opportunity to sort of shop local, shop small.
Great.
So a couple of other things we learned. One of the third question that asked about Missoula County's
the attitudes.
concerns related to vaccines. And more than 80% agree or strongly agree with statements about vaccine effectiveness in protecting their personal health, the health of their children, and the community. So overall, there's very low vaccine hesitancy in Missoula County, which we were very happy to hear. Of that, it was interesting. So of the 52% of the households who'd never used Missoula Public Health for vaccines and had not received a vaccine anyplace else in the last 2 years, said that it's because there's a disagreement in their household on whether vaccines are necessary. And when they did the interviews, the qualitative interviews of this, it really came down to, I think, more specifically COVID as its own separate factor. Like there's so much to unpack with COVID vaccine, whereas the other routine vaccines, maybe there's more agreement on. But COVID was identified as a kind of a sub-chapter in that disagreement. But you might have a parent and a step-parent or another parent, and they have differing opinions about vaccination for their kids. And so then, their kids, until they're older, maybe aren't getting vaccinated until they can make that decision on their own. So that was really interesting. And then a couple of other things that came out of that we're also looking to make a change with. There was a percentage, I think it's 24%, that said we're not in network with their insurance. We know that we're not contracted with United Healthcare and TRICARE because it's just been hard for us to get those contracts in place. I'm hoping we're breaking through some of our own barriers with that, and we'll be able to do that starting with United Health. So I know that would be helpful to a lot of people because this community, a lot of people have both of those insurances. So it would be great if we could serve them.
On the third question around, I was calling it attitudes or concerns. Was there anything in there that was surprising to you?
Well, I think it was reassuring that more than 80% of the people don't have vaccine hesitancy. And so that made me feel really good earlier this spring going into this year with the change in the administration, with the changes at the CDC, that our community overall believes in vaccines.
Is it possible for you all to get data on actual vaccinations across our community, like X percentage of adults have been vaccinated for COVID in this year or that? I don't know. Is that possible?
It's really hard.
Because there's so many delivery spots, right? If you go to your provider or a pharmacy or the health department.
And the state has not really set up a robust system for collecting and tracking that data, not even within the school system where certain immunizations are required. Montana is one of the only states that doesn't compile that data. There's been some recent changes at the legislature that's made it even harder to fully understand our statewide student population. So, we work closely with various organizations in town, including our schools, and then, supplement with something like this really targeted assessment to get a pretty good idea of the cross-section here. But I would say it was nearly impossible to understand, especially per vaccine, kind of what our immunity rates are. And that's unfortunate because community immunity is a studied and evidence-based principle. And for different diseases, you have kind of different targets that you want to get to where you don't have to worry about a very big community outbreak.
Are there outbreaks of specific diseases going into winter you guys are kind of actively concerned about?
Well, definitely our infectious disease team is monitoring reportable illnesses, which include influenza and COVID.
What's the long running?
Measles?
No. It's like been going on for
Pertussis?
18 months or whatever, 9 months. Slow moving outbreak that we're in the middle of.
I thought it was
that's
measles.
the Group A strep.
Yes.
Oh,
That's
Group A
what it is.
strep.
Different.
Group A strep.
Oh,
Yeah.
that's the wound
Yeah,
strep. That's the wound strep,
But
not the strep throat
that does
strep.
bring up a really good point and might answer your question in a more general way about, what kind of diseases are sort of on our radar
Yeah.
this respiratory season or in general. I think that public health does such a good job collecting reports of infectious diseases and having conversations and talking to those and investigating what the source of that disease could have been and kind of putting a ring around it and protecting our community in that way without it ever being known. So, there's communicable disease in our community all the time, every day. And the fact that public health folks are every day of the week taking those calls and trying to figure out the source and how to prevent further spread is something that people don't always know about, because that's the point. We don't want there to be a gigantic outbreak that really increases the burden of disease in our community and takes up hospital beds and takes up provider time. And, it's something that we certainly want to avoid, and public health is working on every day.
Wash your hands, folks.
Wash your hands and certainly stay home when
I
you're
feel like
sick.
it's more part of the great invisible work that local government does. We just assume things work out, and in part around these types of diseases, they work out because you all are doing this type of labor.
Which is the positive side. And maybe this could be a go back, I'm not sure, to something we talked about earlier, but I think awareness is something that we're really trying to raise right now. And we talked about, some of the delays with the ACIP committee meeting and making those decisions, and then a somewhat delayed sort of adoption or endorsement by CDC, and the mayhem that actually caused in the delivery system. That was maybe step one. So there was another scheduled meeting of the ACIP to look further at different vaccines and different schedules for different age Americans, and that meeting was canceled or likely postponed due to the shutdown. So in terms of public health practitioners who are really about disease prevention and trusting these vaccines, who have gotten us so far in our history in terms of reducing disease and improving life quality and length of life, we certainly have an eye on what's coming next. Because, we're happy to hear that not many folks in Missoula have specific concerns or really strong vaccine hesitancy. There's an entire national conversation, and it could be about, for example, the childhood immunization schedule. As we all know, there's all kinds of ways that we can protect young people against preventable diseases, and we want to see those protected. And so when the federal government is back at work and there's another scheduled meeting of the ACIP, Sarah and I are certainly going to be watching it and trying to inform folks in our community about what's being discussed and how you can have your voice heard.
Did we make any changes based on what you guys learned with the assessment?
Yeah, we certainly did. The point that I brought up about people not knowing that the health department provided all routine vaccines, and if they would have, they would have made a choice to use our services, has led us to sort of an outreach and advertising campaign, the likes of which our clinic has never seen.
Great.
Sarah has some great ideas about where we can be advertising to meet certain populations, kind of where they are. We have billboards, we have some magazine ads. We're working on hopefully getting some of those, you see the bathroom stall signs.
Yeah.
I tell you
Yeah,
what,
yeah.
I don't think I'm an advertisement consumer until I'm in a public bathroom.
Yeah, exactly.
Don't
How
edit
about
that
the
out.
side of
Yeah.
the bus?
The side of the bus. We
Yeah,
didn't
I
think
think
of that.
especially with
Yeah.
folks who are riding the bus.
Yeah. We've also visited all the community councils, not yet, but we're getting close to
Oh, that's
having
great.
all of them visited to just
That's
talk
great.
about the assessment and let them know what we have to offer.
I think they'll really be interested in this
Yeah,
assessment.
they've been really great to visit so far. I've made it through about half of them, and they've had some really great ideas about their own
good.
specific community, about
Good.
where to hold a clinic, where else we might be missing for advertising.
Nice.
Some trusted community partners who could be those messengers for us. So that's been great. Yeah.
Well, if we were to just, as we come to a close here, look back on, I'd ask you guys just to consider public health in general. What's something you really want people to know about what public health is?
I think something that I want everyone to know and really consider and probably internalize is that we can't do public health alone.
Yeah.
You can't really opt out of public health. It's what we as a society do together. It's the things that we have agreed will create.
It's kind of like what happens when somebody chooses to opt out of traffic laws.
Right.
We got to all do it for it to work.
We've got some basic common agreements that, when we support them and when we fund them and when we all agree and move in that direction, we have amazing capacity to improve everybody's health. And it's public because it's not health care. This is public health. And the possibilities really are endless if we could get everybody in the boat.
Oh, that's a good one, Gina.
And Sarah, you've spent some time like all over the world working in some really unique places. Like what do you see when that community buy-in isn't there? Whether people don't have the resources to buy in or they choose not to buy in.
Things are a lot harder. Right? You have more people who are sick. You have more people who are unable to work. You have more people utilizing the medical system. Costs are more expensive for all of those reasons. When you think about prevention, it's an upfront investment, and it's an investment not only in yourself or your family, but in your community. And it's something that I would love to see a shift in our society, that we embrace preventative medicine.
And one thing Sarah has taught me in her work in developing countries is that actually, oftentimes, their system for vaccine delivery is stronger than ours.
Really?
And so while there might be a much smaller GDP and in general a larger percentage of the population living certainly below whatever poverty line has been established, their rates of preventable diseases is lower than it is in the United States because of the strong uptake and strong delivery system for vaccine.
Are there lessons there we could learn?
For every dollar you spend in prevention, which includes vaccines, you get about $7 or $8 back. And that's a good stat. That was an economic study from about 10 years ago, and so I don't know how inflation impacts that, but
wow, that's a good one.
It's worth the investment for sure.
Well, is there anything else around vaccines or public health you want to make sure you get a chance to say?
Yeah, so every fall we do an offsite clinic season. So we try to hit all of our rural communities. We're out and about, just trying to make it easier for people to access flu and COVID vaccines. And compared to last year, it felt like we were seeing more people, like there was more interest in our services. And so comparing last year's time to this year's time, we still did 19 offsite clinics, so that
19. That's fantastic.
It's great. And we did 19 last year, so we didn't add any more clinics specifically. But this year, we saw 783 people so far, and we gave over 1,200 vaccines. Last year, we saw 524 people, and we gave 884 vaccines. So that's
the scarcity mindset.
Yeah.
Yeah. And that very well may be part of it, when you have supply and demand.
Sure.
And people are like, oh my gosh, I can't
get this while I can.
So I better get it while I can. Yeah. I've heard that question come from people. I also hope that it's a collective response in wanting to protect yourself and your family from getting sick for this season.
When did these clinics happen?
Through most of October.
Ah, okay.
Yeah.
Vaccines are the new Birkin bag.
Yeah. I mean, I felt that way. A lot of people were getting sick in September and early October, and I was like, oh my God, I need to get my flu shot. And I was
watching the federal government and the ACIP not meeting and a whole bunch of people getting terminated. It did feel like, oh man, this is going to end. If I want one of these, I better get on it before it's impossible.
And there's some valid concern to that. And when the ACIP meets again, they are looking at the childhood immunization schedule.
When's that meeting?
It's to be determined with the shutdown.
No idea.
It's on hold right now. They were supposed to meet again in October, but it's definitely something that we're concerned about. And if they start to change that schedule and those recommendations, again, that how everything is tied to it with the Vaccine for Children program and whether insurance payers will and can pay for it. So all of that is to be determined.
Right, and the concerns that we will have will be immediate, of course, but remember that vaccination is a long game. And so while in the months following some sort of change, however small or radical, to a childhood vaccine schedule that's been sort of institutionalized for decades, we don't see those impacts for the next 6 months or maybe even the next year. But when we start seeing outbreaks in our schools or a whole bunch of our young people really, really debilitated by diseases that are preventable, that could happen years down the road. And the collective burden the risk is significant. These are contagious diseases.
All right, well, we're going to hit you with our last fun question. So In the recent past, have you run across some nugget of culture you feel like that really stuck with me and I'd love to repeat that, whether it was something you heard in a podcast or read in a book or saw on a Netflix show or ran into in conversation, just something that you thought, man, that was really interesting. My brain's going to hold on to that for a minute.
I get so excited to talk about this. When you said nugget of culture, I just finished a book by John Green called Everything is Tuberculosis.
Of course you did.
Right? I know, and a dramatic title. But
That
let me
is
tell
a
you,
really dramatic title.
Everything is tuberculosis.
What is that? What does he mean by that statement?
It is a cultural nugget for sure, because it talks about the way tuberculosis, was first thought of before the entire germ theory was even known to man, all the way to what that looked like in developing the United States.
But I thought it was
the
like
cowboy
TB was
hat is tuberculosis one.
Oh.
And that's important to us who grew up on a ranch. The cowboy hat is influenced by tuberculosis.
Yeah.
You have to read it. It really is about the complete misunderstanding about tuberculosis and what it is and what caused it. But a lot of times our more populated areas on the east side
It's
of
like
this
a character
nation,
flaw if you get it.
you had to
You
move
deserve
west
it.
because you needed dry air.
That's how my great-grandmother came here.
Right?
There you go. The dry air
so
would keep you
there was a
healthy.
hat maker on the eastern side of the United States who had some really avant-garde and cool headwear going on, and he got tuberculosis and he had to move west, and then he designed something for vaqueros and cowboys.
All right.
That is
Wow.
great.
Yeah.
Love the connections.
It's a great book.
Cool. Everything is
Can't compete with
tuberculosis.
that.
That's a good one.
I just said I can't compete with that. It's too great of an example. I'm like, I'm not that interesting.
Everything is public health. Everything is public health.
Yes.
Everything is public health.
Yeah. I think what you're learning is Sarah and I are just at work all the time.
Right.
It seems
Just
like
so-
that.
Yeah.
Yeah.
Well, what gets you through your grind? Like, you guys deal with some really difficult stuff.
And the stakes are high.
Yeah. I mean, I need to connect with the outdoors, so that's how I deal with it.
What does that look like to
Touch
you?
grass. They're so hip.
Right?
Yeah, that's
Oh,
that's
it's
what the
more
kids
than
say,
touch
but
grass
what
for
is-
Sarah. She
what does it
travels
look
the
like?
world
Yeah.
taking wildlife photos.
There you go. I'm
Also
looking for
do.
that.
You
Yes.
do.
Yes.
Yes.
Where do you like to go? Or where have you been recently that was wonderful?
Well, we most recently were in Yellowstone a couple times.
Nice.
Love Yellowstone. I've had a connection there since I was a kid.
Okay, the photograph that
Yeah.
you've made that's moved you the most
Okay.
recently.
I would have to say this was from a number of years ago, but this was my Spirit Bear trip in British Columbia.
Oh.
So Spirit Bear it's a Kermode bear or a white
Yeah,
black bear.
A white black bear.
You got a photo of a spirit bear.
2 Spirit Bears.
Whoa. How did you do it?
We went on a sailboat with a tour company, and we went out into a very remote area in British Columbia, and were invited by the First Nations to come on their island, and just got to experience a day with the bears coming down and feeding in the.
So what's the photograph?
I have many photographs.
Oh,
of
no,
them,
just
but
one.
just
What's the one? The one photo.
I think it was she's the National Geographic cover bear. It's great grandma. I got to meet her. And so that was pretty-
Wow.
She was old in 2017, and she was still holding her own, catching fish and eating the heads off, just like all the other bears. And she looked great. So it was incredible. That was a very moving experience.
Oh, that's awesome.
Good for you. Well done.
Yeah.
And well done to you both on the work you do. We really, really benefit. Thank you.
Yeah,
Thanks for
thank
having
you.
us.
Thanks for having us.
And thanks for coming today. Thank you for listening. Thanks for listening to The Agenda. If you enjoy these conversations, it would mean a lot if you'd rate and review the show on whichever podcast app you use.
And if you know a friend who would like to keep up with what's happening in local government, be sure to recommend this podcast to them.
The Agenda with the Missoula County Commissioners is made possible with support from Missoula Community Access Television, better known as MCAT, and our staff in the Missoula County Communications Division.
If you have a question or a topic you'd like us to discuss on a future episode, email it to communications@missoulacounty.us.
To find out other ways to stay up to date with what's happening in Missoula County, go to missoula.co/county updates.
Thanks for listening.